musculoskeletal system today and check your strength. I'm going to start off with your temporomandibular joint, which is in front of the tragus area of your ear, and I'm just going to have you open and close your mouth and move side to side, protrude and retract. And is there any tenderness in this area?
No.
No. And there was some slight popping, but nothing. And then, so it's full range of motion of your temporomandibular joint with no pain, no tenderness. So I'm just going to check your neck and cervical area. I'm just going to palpate your cervical area. Any tenderness?
No.
Okay, good. I'm going to have you flex your head down, head back up, ears flex back, extension, and then ears to the sides. And then turn your head side to side. That's good. I'm going to have you press against my hand. And then each side, press, and then press. Very good. So your neck has full range of motion and +5 strength. And there wasn't any tenderness when I was palpating anything?
No.
Okay, good. So I'm going to have you stand up and assess your spine. And I see that your cervical area is concave, your thoracic is convex, and your lumbar is concave. Palpate your cervical column. Is there any tenderness on palpation?
No.
Good. And I see that your shoulders are equal and your hips are equal. I'm going to have you bend forward and touch your toes, and I see that your spine is straight and in alignment. So that's good. Flex all the way back. It's hyperextension. And hands to your sides and standing upright is just called extension. I'm going to have you bend side to side. That's lateral bending. And then I'm going to have you rotate your arms and swing your body, and that is rotation. So I'm just going to feel your shoulders, feel any nodules or fogginess. I mean, do you have any tenderness when I'm palpating?
No.
And I don't feel any nodules or any swelling. So I'm going to check the range of motion on your elbow. And do you have any tenderness in your elbow at all?
No.
And I don't feel any swelling or any nodules or any fogginess. I'm going to check the strength of your elbow. So I'm going to have you push up on my arm. Good. And then push down. Very good. So there's +5 strength in the elbow. I'm going to have you check the range of motion. I'm going to have you just move your arm up. So that's flexion. And then move your arm down. That's extension. So that's good. So full range of motion, +5 in the elbow. I'm going to check your wrist. I don't feel any fogginess or any swelling. Is there any tenderness?
No.
Good. So I'm going to check the strength of your wrist. I'm going to have you flex down. I'm going to have you push up. Good. I'm going to check the range of motion. So I'm going to have you flex up. So that's flexion. And then straight is extension. And then down is hyperextension. And then in towards your thumb is ulnar rotation, ulnar deviation, and then outward is radial deviation. So you have full range of motion of your wrist, and it's +5 strength. So now I'm going to check your fingers. I'm going to check all the joints. I don't know any nodules or any fogginess or any swelling. Is there any tenderness in any of the joints? No. Good. And your thumb is the same as well. So I'm going to check the range of motion of your fingers. So make a fist. That's flexion. And then straighten them out. That's extension. I'm going to have you fan out your fingers, which is adduction, and then back in is abduction. And then I'm going to have you hold your hands out straight. And that's supination, and that's pronation when your hands are palms down. I'm going to check the strength of your fingers. And I'm going to have you squeeze my 2 fingers. Very good. So it's +5. And then I'm going to make the OK sign. I'm going to check the strength of your thumb. And it's +5. I'm not able to open up the finger grasp there. And also +5. I mean, there's positive range of motion, +5 strength in your hands. So I'm going to have you sit again, and we'll palpate your toes. Now, all the joints for any swelling, nodules, or swelling or nodules. I don't see any. Is there any tenderness when I palpate your toes? Good. So I'm going to check the flexion, and check the range of motion of your toes. So I'm going to have you flex up, which is dorsiflexion, flex down, which is plantar flexion, inward, eversion, and out is inversion. And then I'm going to have you push up on my hand, good, and then push down on my hand, good. So you have full range of motion of your toes and +5 strength of your toes. So now there's some carpal tunnel testing. So I'm going to have you put your hands together like this, called the Fallon test. And you would hold it for 60 seconds, and if you were to feel any numbness or tingling, it would be positive. Do you have any numbness or tingling in your hands? No. So it's a negative Fallon test. And then I'm going to hold your hand and press on the median nerve. And do you feel any numbness or tingling?
No.
So you have a negative Tinell's test. Thank you. Okay, so now I'm going to have you lay down, and I'm going to check your hip joint. Is there any pain or tenderness as I palpate?
No.
And I don't notice any nodules or any bogginess or any swelling. So I'm going to check your range of motion. So I'm going to have you lift your leg up and back down. I'm going to have you bring your knee up into your chest and back down. So that's flexion and extension. So I'm going to have you bring your knee in and then have your leg externally rotate. And then internally rotate is in towards the body. And then, which is adduction is out and abduction is in. So you're doing external rotation is adduction, and then internal rotation is adduction. And then you have full range of motion of your hip. So I'm going to test the strength now. So how you lift up, go inward, outward, and down. So you have +5 strength of your hips. So that's great. So I'm going to have you sit up, and I'm going to check your knee. Is there any tenderness when I palpate?
No.
I don't notice any swelling, any bogginess, or any nodules. So I'm just check the strength of your knee. You're going to have you push up on my hand. Good. You're +5 strength. And it's going to assess your ankle. I don't know any swelling or any nodules. Is there any pain upon palpating your Achilles tendon?
No.
No. So that's good. Yeah, I'm Sheila. I'm going to check into your cranial nerves today. So I'm just going to do a mini mental status exam, and I'm going to just ask your name.
Cynthia McCartney.
Your date of birth.
4/25/67.
The date.
October 13th.
The year.
2015.
And the president.
Obama.
Okay, good. So I can see that you're alert and orientated ×4. So I'm going to check your cranial nerve number 1, your olfactory. It's going to check your sense of smell. So I'm going to have you close your eyes and include one nostril. And I'm going to have you sniff in just 1 second. Take a good sniff. And what do you smell?
Vanilla.
Okay, good. So your cranial nerve number 1 is intact. I'm going to check your cranial nerve number 2, which is your visual acuity. So I'm going to do the Snellen chart, and I'm going to be 20 feet away. I'm going to just have you occlude one eye, and the lowest number that you can read.
DEFBOTEC.
And the other eye?
DEFBOTEC.
And then both.
DEFBOTEC.
And so you're 20/20 with corrective lenses, because you're wearing contacts?
Yes.
So I'm going to check your near vision by having you read a line of this newspaper.
1 internet speed hardly fits all.
Okay, great. So your near vision is intact. So next I'm going to do check your peripheral vision by doing the confrontation test, and I'm going to have you cover one eye. I'm going to be wiggling my fingers, and you're going to let me know when you can see them. So this is superior,
I see it.
lateral,
I see it.
and then inferior.
I see it.
Okay. So your confrontation is intact. Next, I'm going to be checking your cranial nerves 3, 5, and 6 to test them all together. And take a light and look into your eye to see if it constricts, and then we'll do the same exam to see if both pupils constrict, and we're checking for consensual and direct. Checking for direct and consensual. So your left eye is constricting, and then when I do the test again, I'm checking at both eyes, and they both do constrict. So you're constricting directly, and you're constricting consensually as well. I'm going to check for accommodation because I'll have you look across the room, and then I'm going to put my finger towards you, and I'm just going to be checking for convergence and see if your pupils constrict.